House Budget Review Subcommittee on Justice, Public Safety, and Judiciary for the 2025 regular session. This morning, we're going to hear from, I think, Randy White from the Department of Juvenile Justice, and we are going to talk about several things, including the Louisville Detention Center project, the Linden Facility project, medical services contract, an update on the high acuity juvenile mental health treatment facility, and some overview on the current juvenile detention center and the cabinet's telework. So I'm going to call this meeting to order, and we'll call the roll.
Representative Bray, Representative Decker, Representative Kulkarni, Representative Sharp,
Present.
Representative Bowling, Representative Elliott, Representative Petrie, Chair Dietz.
Here. And we have minutes to approve, so I'll need a motion on the minutes.
Motion.
And a second? All in favor? Aye. Okay, approved. Mr. White, good afternoon.
Good afternoon.
If you would like to introduce yourself.
Yes, good afternoon. I'm Randy White, Commissioner for the Department of Juvenile Justice.
Okay, thank you for coming today. I'm going to go a little bit out of order. If you could maybe start with giving us a broad overview of the detention centers that we have and where they're located and currently open. Just thought that might make more sense before we take the deep dive into the individual ones.
Okay, I'll try to do this from memory and hope I don't miss any. So I've got a team behind me that I'm sure will remind me if I do. But currently, our detention centers that are open and operating, starting with the female facility in Boyd County, followed by a low-risk male facility in Breathitt County, a high-risk facility in Fayette County, and that's a male facility. The only female facility is in Boyd County. A high-risk, high-risk in Fayette County, a low-risk male facility in Campbell County, and that also accepts the low-risk offenders from Jefferson County as well. That's where we're housing low-risk currently for Jefferson County. Have a high-risk facility in Adair County, and they house offenders that are high risk from surrounding counties in addition to Jefferson County. Have a high risk facility in Warren County that houses males, and finally a low risk facility in McCracken County that houses males. That's it for the detention facilities. And is there any specific information that you would want to know regarding each facility?
Sorry, to start, I just wanted a broad overview of what we were looking at, how many detention, and I know I'm asking you this from memory. I guess I would like to ask about Boyd County with the females. Is that full capacity at this time, or do you know how many that takes?
We can house 33 individuals in that facility. We tend to stay close to capacity, and I'll go through my notes and give you specifics, but we tend to stay at capacity. Sometimes the population will fluctuate. We will exceed capacity, but usually we will stay close to full in that facility.
And right now, Boyd County is the only facility housing females in the state?
Yes, ma'am. The only detention facility housing females. We have an Alternatives to Detention and a Youth Development Center in Moorhead that houses females.
Okay. And then in Breathitt County, you said that was low risk for males.
Yes, ma'am.
Is that also, are you at full capacity there? Do you know?
No, we're not at full capacity there. We're probably operating about half capacity there, but the population fluctuates because they service multiple counties in the area.
After that, you listed Fayette County, the high-risk facility.
Yes, ma'am.
Same question, if you know.
We usually, and again, Fayette County is a high-risk facility, and they service multiple counties, so we will usually stay about 80 to 90% full in that facility.
And then you listed Campbell County, which I think you said is housing males right now. And do you know the capacity in Campbell County?
The bed capacity is 43. But operationally, we try to limit limit because of the staffing levels to the mid-20s, around 25 offenders in that facility because, again, the staffing levels.
And then you listed another high-risk facility, and I did not get the county on that one.
I believe that was Adair
Okay,
County.
Adair County. Same question. Do you know if you're at capacity on that one?
We are not at capacity currently, but again, the population will fluctuate. We can hold 60 offenders there. We have been at capacity several times throughout the course of this past calendar year. Right now, currently, we're seeing a small decline in the population. And again, the population will fluctuate, but we're not at capacity currently, but we've seen it various times hit capacity.
And then Warren County, high risk.
Yes, ma'am. Warren County is a high-risk facility. It can hold 43 offenders. We tend to operate close to capacity there in that facility most of the time.
And then lastly, in McCracken County, low risk.
Yes, ma'am. That's low risk. We can hold 43 offenders there. Again, the population fluctuates. We're not at capacity within that facility currently.
And just with these that we've talked about, are there any issues currently with staffing with any particular one more so than the others?
What we typically find is that in the higher risk facilities, it's more difficult to staff those high risk facilities, but not all of them, but some of them. Usually when we're around a robust job market in a metropolitan area, it's more difficult to staff the facilities in those types of regions.
Why is that?
I think because of the wages and the cost of housing. I think it's more difficult for staff to be able to afford housing in those major metropolitan areas.
I'm just going to ask if anybody had any questions on the broad overview before I start asking questions. And the next one I would go to is the Louisville Detention Center and an update. Are there any questions on just the broad overview right now? No. So if you'd like to go ahead and talk about the Louisville Detention Center project.
Sure, and I've got a script that I'll read through and be happy to answer any questions. We have some good news to talk about the Louisville Detention Center, and so I just want to be clear that the Louisville Detention Center, we have two different facilities in Jefferson County. It is the downtown facility in Metro Louisville and the Linden renovation project. So I want to be clear that we're talking about the downtown facility. Okay. So Phase A, the schematic design, and Phase B, the design development, has been completed on that facility. Phase C, which is the construction documents, began in November 2024, and the current timeline anticipates our ready-to-advertise documents to be submitted at the end of this month or early March. Anticipated bid opening for that project and issuance of a construction contract is anticipated to be April of this year. Construction duration for that project is anticipated to be approximately 22 months, with final completion in March of 2027.
I already had one text this morning from a former representative, now a council member in Louisville, asking why it was taking so long. Do you believe that you all are on track where you should be, or has there been reasons for any kind of delay?
Yes, ma'am. The required renovation is very extensive. When you get into renovation of buildings and trying to bring those buildings to current HBC and life safety codes, the project includes a minimum of 64 beds. We have to look at perimeter security of that facility, electronic security upgrades, and I realize I'm getting a little in the weeds, but I want to provide you more information than not. Mechanical, electrical, and plumbing upgrades and replacements, food service infrastructure and equipment, a roof replacement, and other updates required by building code, as well as ACA, which is American Correctional Association, and the Prison Rape Elimination Act requirements. So, long story short, when you get into a project that's renovating an existing building, it's very complicated. We have to go in and analyze that building, and if there is something that doesn't meet current life safety or housing building codes, we have to figure out how to get into code compliance and what it's going to cost. So it's taken quite a bit of time to analyze that existing structure.
but right now projected to be completed March of 27.
2027.
And can you tell us, and you may have said this in your opening and I missed it, how many beds will this be designed for?
Right now, what we anticipate is 64 beds, and that facility will be intended for high-risk Jefferson County youth.
And is this for men and women?
No, ma'am, this is for only men. It would be very difficult to try to arrange that facility to house both males and females, and besides, I think the language in Senate Bill 162 requires us to separate high and low risk males from females, but also a governor's directive is to house males and females in separate facilities.
And there's no one in this facility right now, correct?
No, ma'am, it is a vacant facility currently.
And where are those youths being housed right now?
The high-risk offenders are being housed in Adair County, and the low-risk offenders are being housed in Campbell County.
And I guess as far as budget, where do you see? Are you all within budget? Do you anticipate going over budget at this point?
Well, let me ask a question for your question, ma'am. Are you talking about the operating budget or the construction budget?
The construction budget.
At this time, through the design of the facility is 4 stories tall, to include the basement, which is an unoccupied space. It just houses, a laundry in certain areas. So within the allocated budget, we are able to anticipate renovation for the basement, the first floor, and the second floor of that facility. The top floor, we don't think that it will be in the budget to renovate that floor, but we do think that there will be sufficient funding in the budget to prepare that floor for a later phase of renovation.
And I'll open it up for any questions on this facility. No questions? If you want to then move on to the Linden facility project.
Yes, ma'am. And the Linden facility, of course, it's in the Linden neighborhood, and that's why we differentiate between the downtown and Linden, just for identification purposes. But we have some good news for the Linden facility. The project includes renovations to the intake area, improved security controls, and conversion of dry cells to wet cells. So we'll locate sinks and toilets in those cells. The construction contract was issued November the 21st of 2024. Final completion of the renovation of that facility is anticipated to be June the 14th of 2026. Interior demolition is actively underway and progressing appropriately, and that's the good news. The contractors are on site, and they're actively tearing out what we don't want in preparation to go back in and renovate the facility. Bed capacity, we anticipate 34 beds and 4 separate pods, and to include the intake area. We intend to house low-risk offenders in that facility.
And I guess the same question, where are those youths being held now? Is that Adair County and Campbell County?
The low-risk offenders are going to Campbell County to a low-risk facility so that we can keep high and low risk completely separate.
And then where are you all within the budget? There was $4.5 million authorized. Do you believe that right now, does that look like we'll be within budget on that project?
Yes, ma'am. It looks like that we'll be on target time-wise and on budget for that project.
Next, we'll go on to the medical services contract.
Okay, in order to be very thorough and to provide you all the information that you need, and I realize the reason that we're here today is because you all are very interested in providing legislative support to the DJJ to enable us to carry out our mission. So I brought sufficient staff with me that's located behind me, and I'll ask Mr. Elzieberger to come up and sit with me as we go through this, because I anticipate questions, and I know that you all are very interested in what we're doing. And so Elzie is an executive director with the Department of Juvenile Justice, and the medical branch falls within his scope of supervision. So I will go ahead and go through the notes that I have and the information, and it's quite a bit. So Would you rather talk about the medical contract first or the medical facility?
I think I'd rather talk about the contract first.
Yes, ma'am. So the DJJ is working to ensure that the allocated funding is the best use of the money, that the department maximizes the benefit of the funding that we're getting. DJJ is continuing to conduct site visits and assessments to ensure medical and mental health coverage for all of our facilities. We're reviewing the use of a current state contract provider with an alternative of an RFP. If we determine that the current state contract provider is the most appropriate and effective option for provision of medical services, DJJ would request a modification to the current contract between the Commonwealth and the provider to establish a contract. All current DJJ merit staff will be retained and unaffected by the implementation of a potential contract and a contractual provider. If a merit staff member leaves DJJ, then the department would evaluate whether that position should remain merit or be considered for inclusion within the contract. Additionally, DJJ employs 4 nurse program administrators who currently oversee the medical program and ensure compliance with all applicable standards. These positions currently provide oversight and ensure contract compliance and would continue to do so under the new contract model. I realize there's probably a lot of questions and we're prepared to answer the questions, but to sum it up, we're currently negotiating with a contractual provider and we have conducted site walkthroughs. We anticipate maybe in the next 30 to 60 days we would be able to entertain a contractual proposal.
And the current provider is who?
We have, you want to answer that, Elsie? Okay.
Currently, we use a staffing service known as Emeritus. It's a PON 3 master agreement through the state. A lot of different cabinets use it. We use it right now to staff our RNs, LPNs, and our nursing structure, our APRNs as well as our chief medical officer. And then we also use it for retaining qualified mental health professionals for our mental health programs.
Are there any services that are going to be excluded from the contract?
No, not right now. We're, as the commissioner said, we're looking at the vendor that DOC uses right now and what their contract structure is like, what our current needs are, and working through that process to determine.
And is that current vendor WellPath?
It is.
All right. So in preparation for today, when I was looking online, I saw that WellPath has filed for bankruptcy. Looks like right at the end of the year, the beginning of the year. Were you all aware of that?
Yes.
Okay. And will that impact how you're looking at WellPath going forward?
So we reached out to them, had conversations, and that portion of what they're doing does not impact the Kentucky contract, is our understanding.
Okay. What is your understanding? What does it impact?
It impacts kind of their acquisitional structure somewhere else, but we were given assurances that it would not impact any delivery of services or ability to contract them within the state of Kentucky.
And I couldn't see online. Do you know what type of bankruptcy they filed?
I do not recall. I apologize.
Okay. Have you all asked for any of that information?
Yes, ma'am. We have asked for that information, and there's some specific in the weeds questions, and we did get in the weeds with WellPath. And I would have to have a procurement person here to really explain in detail what I cannot explain. But we were satisfied once we asked quite a few questions because we knew about the bankruptcy filing within a day of it occurring. And so we did ask multiple questions, and we were satisfied that at the conclusion of all those questions that we would still be on solid ground with negotiating with this particular contractual provider. The tenets of the bankruptcy, it was far removed from how it may affect the Department of Juvenile Justice or the Department of Corrections.
Okay.
And there could be additional questions, and we can get you additional answers from the procurement experts.
Yeah, I think I would be curious what type of bankruptcy they filed. From what I could tell, it looks like maybe they filed it in Texas. I mean, I have a litany of questions I'd love to ask about the bankruptcy and where we fall within that and what effects we could have.
probably be some legal questions or some legal answers as well from the legal experts. But we did ask all those questions. It was quite a bit of discussion because I wanted to know, are we on solid ground with continuing negotiations? And at the end of those questions and the sessions, we were convinced that we were okay to continue those discussions. I think I would like to also add that currently the Department of Juvenile Justice is working with the Cabinet for Health and Family Services to begin the process with that agency to become a Medicaid provider. And it's something y'all may well have heard in the media, the Medicaid 1115 demonstration waiver and the 2023 Consolidated Appropriations Act. Any DJJ contractual partner will be required to be a Medicaid provider for any of the services it would provide. DJJ and the Cabinet for Health and Family Services. We're in the initial stages of implementing the 2023 Consolidated Appropriation Act, or the CAA. And so and for the sake of brevity, I don't want to go too deep into that. But if you have any questions, I think between Mr. Berger and I, we would be able to answer those questions.
Okay, thank you. I think Ms. Representative Sharp has a question.
Thank you, Madam Chair. I think I may have a series of questions here to get to where I'm going. The contract you've got with WellPath, my understanding is it's basically nursing and with a medical doctor oversight.
We don't currently have a contract with WellPath. We use Emergis.
All right, is that
Yes, sir.
regardless of the contractor? But is that it?
Yes, sir.
Is there a doctor at every site, or is
No, sir. There is a chief medical officer that's available on call. She can go to physical locations and take calls. And we have 3 advanced practice registered nurses, APRNs, that cover this facility statewide. So they're in person on certain days, and then they're on call as well. And then in the building are a nurse supervisor that's an RN, and then a series of LPNs or RNs that are in the building for 24/7 staffing.
okay? So how many? What's the breakdown number-wise between RNs and you have one medical doctor? So how many RNs do you have?
Roughly, let's see. Between RNs and LPNs, I have approximately 82 across the state right now.
Now, what do they take care of, and when do you make the decision that it's beyond their capability and you have to go to another facility?
They follow all the medical protocols that all their licenses require, as well as we have a medical SOP. And so, the guidance that we have given them is, they're allowed to do anything that they're legally allowed to do through their licensure and their training. But if they have any doubts, then we refer it to the APRNs. For the initial consult, to the medical doctor. If it's an emergency circumstance, they go right to an emergency room setting, and they'll remove the youth from the facility and take them to the local emergency care provider.
And what is the amount of the current contract?
The amount of the current contract, I think, as approved recently under GCRC, should be $20 million for this current year, and then it would be $20 million for next current year, for next budget year.
Okay. So we have 82 nurses and LPNs,
Yes, sir.
and we got a $20 million contract covering the 7 current detention facilities, and we have one medical doctor, and that's kind of the nutshell here of the health services for your
Well,
organization.
just to add in, we cover youth development centers and the detention facilities, and then a certain number of hours per week of coverage for the group homes as well.
Okay.
Yes, sir.
All right. Thank you, Madam Chair.
Sure.
Thank you, Mr. White.
I think last question on this negotiating with WellPath. When will you all make a decision? When do you anticipate making a decision if you're going to?
Sorry. We're currently finishing up. We should be completed with the walkthroughs and the site assessments that WellPath would have performed. And from what I understand from this point forward, based on those site assessments, they're going to propose a potential contract with us. And again, we think within the next 30 to 60 days, we would be able to receive that and to begin the review process.
And you'll keep us informed when you make that decision and you
Absolutely.
hear from them? Okay, thank you. Now I'd like to talk about the high acuity juvenile mental health treatment facility. Do you have an overview you want to present to start with?
Yes, ma'am. So whether a youth has committed murder or even if they are a truant, the Department of Juvenile Justice must accept any youth who is court-ordered to detention. Some of these have severe mental illness that render them extremely violent. As with any youth who suffers an emergency medical crisis, an uncontrollable violent youth needs to be in a hospital receiving treatment. Detention centers are not equipped to treat mental illness requiring hospitalization. Private psychiatric hospitals are not required to accept DJJ youth and routinely refuse to accept or prematurely discharge these youth because of their violent, assaultive behavior, often resulting in hospital staff injuries. Placing a severely mentally ill child in detention is not appropriate placement for the child. Youth with serious mental illness issues can be especially violent and require disproportionate resources to manage. And in addition to that, if they're in a detention facility, often they're disrupting that environment for the other youth that are trying to go to school or trying to have a pro-social environment. While the number of youth who fall into this category is small, they can be extremely disruptive to other youth. The specific group of youth require a disproportionately high number of staff, time, and resources to ensure their safety and security, as well as the safe and secure DJJ staff and other youth. Investing in a high acuity mental health facility or justice-involved youth in Kentucky is necessary to properly serve this group. A dedicated facility would provide access to behavioral and psychiatric care for Kentucky justice-involved youth who have no other viable options. It also provides a safe and secure facility that is specifically designed and built for the task of caring for justice-involved youth who require specialized treatment. A medical facility of this type would significantly reduce or eliminate delays in treatment caused by a lack of beds or the delays associated with external placements. Most importantly, such a facility creates better outcomes and improves futures for youth in the care of the state. The facility would serve youth who have been determined to be determined by a clinical professional following a behavioral assessment to need a secure treatment environment and specialized services. These youth in question are a safety risk to themselves and to others in detention and requires a high level of psychiatric care, and they've been refused placement by the hospitals. You may have heard about a case referenced in the media and legislative testimonies about one particular youth who would have benefited from access to this type of facility. This youth was ordered, detained by a judge, and DJJ had no choice but to obey that order, even though she suffered from severe mental illness. In all fairness, the judge didn't really have an alternative to detention as she was also extremely violent. It was a female juvenile. That said, detention only exacerbates a deterioration in their mental health, and this youth was in danger to herself and incredibly violent with DJJ staff and property. The department tried nine different times to place her in a private treatment facility, both in and out of the state. So we do use external state providers at this time to try to place youth that are in need. Each time this juvenile was refused admission primarily because of her aggressive behavior and her self-harming behavior. In one instance, she barricaded a nurse's door and assaulted a nurse who experienced injuries as a result. In short, she cannot access critical services for her behavioral and mental health needs because she was not an adult. When she turned 18, DJJ filed an involuntary commitment petition alleging that she was mentally ill and therefore a danger to herself and others. DJJ was fearful for her safety when she would be released from detention. Thankfully, the courts and clinicians agreed, and she was admitted to a state psychiatric hospital where she has received beneficial treatment, probably for the first time in her life. It's really disappointing that she could not access this treatment until she became an adult. And if we had a high acuity mental health facility, if it had been available at the time, in this state and to her as a youth, she and others may have been spared years of distress, delays in services, and harm. We know that a high acuity mental health facility can balance and complement security measures and clinical support spaces while meeting statutory requirements. And it's for this reason why Governor Beshear proposed such a facility in the 2024 regular session. And we're very hopeful that this year's legislation in Senate Bill 111 that's being proposed by Senator Danny Carroll in a $5 million funding for the design of the facility will pass both chambers and become law. Senator Carroll has worked closely with the Justice and Public Safety Cabinet and the Cabinet for Health and Family Services for over a year to address the gap in facility and care options available to these specific youth in DJJ custody. And that is reflected in Senate Bill 111. Among other critical need provisions in this bill, such as 2 new additional female detention facilities, Senate Bill 111 requires that a facility be built specifically for high acuity mental health needs for youth in detention, allowing them to get appropriate care if they need a secure state-run medical facility environment. Until that facility is built, Senate Bill 111 outlines a process which incentives for private hospitals to provide inpatient treatment with adequate safeguards and increased compensation. And I'll conclude on this note. In this way, Senate Bill 111 fills a gap in services for youth and that have significant mental health issues and who are violent where private options are limited and detention is not the appropriate setting for specialized, secure care. Governor Beshear and DJJ continue to explore this model and how it should be implemented. But we're getting to the point where we need to take the next step. And that step is in this year's Senate Bill 111, which provides for such a facility in the proceeding design phase. So what we're asking for in Senate Bill 111 is funding for a design of a high acuity mental health facility. And I'm prepared to answer questions if you have any.
Representative Kulkarni.
Thank you, Madam Chair. Thank you for your presentation. I just had a couple of questions related to the facility envisioned in Senate Bill 111. So you said it's $5 million that it's requesting for design. What is the cost if this is built, like the total cost or comparable facilities in terms of not just building but also staffing and operating?
I think, and I can answer your question with an estimate. But until we get deeper into the design and with the current times and materials cost, the design phase would more accurately describe what the cost is going to look like according to what bed space that we need. But we're estimating at this current time approximately $30 million for a facility construction.
For how many beds? I'm sorry, Madam Chair. A few follow-ups. How many beds are you anticipating with regard to the need that you're seeing?
At this time, what we would anticipate our needs would be in Kentucky for male and female high acuity youth would be 24 beds. And that would, within those 24 beds would be an assessment, a treatment, assessment wings, treatment wings, and then a stabilization wings. The experts tell us that we have to separate those groups for proper treatment. So, and that would encompass males and females. And so it would involve multiple wings within that facility because you need the flexibility for the operational management. So 24 beds at this time. Of course, if we could afford it, we would want more flexibility, but that's where we're at now.
Okay, last question. You had also mentioned that you are currently using external state providers.
Yes, ma'am.
Is that right? Can you tell me a little bit more about who they are and what that cost is?
We have sent youth out of state most recently that would accept violent offenders. We most recently was able to place a youth in Pennsylvania So we took that youth to Pennsylvania ourselves, and they were placed into the care of that mental health provider, and they're doing well. They're doing well in that environment, and with the treatment that they're getting. We've had to place youth in other states as well because we don't have the infrastructure here that's that's critical for the treatment of the youth, and it most often involves violence. And so I was planning to have a mental health a psychologist here today, but he fell and sprained his hip on the ice. So I can provide more in-depth information to you, Representative, as to where we're sending these kids and what their needs are and why we can't get those needs met within Kentucky. But again, a high acuity mental health facility would really alleviate all of those concerns, and it would also enable us to quickly get them into a facility without any delays, because as you can imagine, the logistics with trying to get these kids assessed and accepted and then a bed open for them in another state, it's delaying treatment.
And also just the current cost of doing that
Okay.
would be helpful. Thank you. Thank you very much.
Cost and placement locations, yes ma'am,
Yeah.
we'll get that for you.
Appreciate it.
You talked about the cost to build the facility, but what are you anticipating with staffing, and what would staffing look like, and do you have an estimate on the cost of that?
We have not compiled an estimate for the staffing yet. To expand a little bit into the location, of course, we would need to try to locate such a facility close to a major metropolitan area within a reasonable distance, so we would have access to the population center, to the services that we need, and the clinicians and the specialists that we need for such a facility. But if we're funded for the design, then we would begin working on the funding for the staffing costs associated with that facility.
Bray has a question.
Thank you. If you all had the design appropriated and the funds appropriated to do construction, how long would it take to, how long would that process be from, let's say, right now until you could receive your first patient?
I think that, based on other estimates and current projects that we have ongoing, to try to land that plane in a reasonable amount of time probably would be sometime in the year of 2027.
So it could be done within 2 years, designed, constructed, staffed, and receiving patients?
If we're funded for design, then, if we had the total package, if we had design and construction money, we'd probably be better poised to land on that, to land that airplane in that spot. I think probably in order to answer your question a little more accurately, what I can do is call Rebecca Norton up and have her to try to answer that question, because she's more of an expert in that field than I am. She's an executive director with the Justice and Public Safety Cabinet, and she probably has a better idea, wouldn't you? I'm estimating, but you probably will be better.
No, I think Commissioner's estimate is probably accurate. What we've looked at with the 2 female facilities for construction, the actual construction timeline has been sort of estimated anywhere between 18 to 24 months once construction begins, if that's helpful. And those facilities are 28 beds. So as Commissioner mentioned, this is a 24-bed facility, so I would anticipate that it would be, somewhere in that same time frame.
Okay. And then final question, Madam Chair. When we look at cost per beds for different facilities, this one seems significantly higher. We had the people in from Little Sandy last week speaking about that, and then comparing the cost per bed for Little Sandy to this, it looks like it's somewhere around 9 to 10 times higher. Can you explain why that may be, and Have you all looked at possibly using an existing facility or rehabbing a facility somewhere within the Commonwealth to maybe speed up some of these timelines or look at more cost-effective measures?
I'll backtrack just a little bit. With trying to renovate a facility, if we tried to purchase or to renovate an existing facility, we've seen the time that it takes with the downtown Jefferson County facility, trying to bring that up to or life safety codes and housing building codes. And in addition to that, what we want to do is to design a facility where it's not so, it's still secure and it's still a detention facility, but it also meshes with the mental health and a softer appearance and environment for the treatment needs of the offenders. We don't want it to be so detention appearing. And so it's very difficult to try to renovate a building and bring it up to those codes. And we want to look at these as not only as offenders and kids, but patients. So I would be more inclined to say we would be better off building a new facility than trying to find something to renovate. And then that way we could select the location where we want this type of facility located. I spent about 28 years with the Department of Corrections and was the deputy commissioner, and my span of oversight before I retired was adult prisons. And what I can tell you from being a warden and a deputy commissioner is that anytime you look at an increased security of a facility, the higher the custody, the more it's going to cost, the more specialized the services, the more that it will cost to operate that facility, and that's just the nature of human management. So I was the warden at Eddyville, and we required more staff, more intense security, and of course it was an older facility, so the economics of the infrastructure, it was not economical to run an old facility. With the Kentucky State Reformatory, older facilities require more staff to house them because the technology and the design of a facility really can do a lot of the work for you. If it's modern in design and you don't need as many staff, you can use the technology. But with providing mental health services, you really need more staff. It's more staff intensive, and there's really no way around that. So just a few of the operational considerations.
So how would this facility, when I just look at the cost per bed, it doesn't, and maybe it's an economy of scale issue, but I think the numbers I saw were for the 28 bed that you had referenced earlier was like $43 million per facility. And when you do the math, that's like $1.5 million per bed. Compared to, some of these other facilities that we've put investments in, it seems like that's, the cost per bed is astronomically higher. What's the reasoning for that? Or because, I would think with less security, the cost would be less. So if you don't care, just kind of touch on that.
I think the first consideration with this total operations of such a facility is that it's going to be a detention facility, and really you can't compare the cost in adult corrections to this smaller facility, because you get more bang for your buck in a big facility like corrections because there's more inmates that goes through their dining room, there's more inmates that will live in those dorms, that there's more inmates in the package. So you get more bang for your buck in the bigger facilities. Now it's arguable whether you can supervise them better, but in these smaller detention facilities, it's more specialized. It is a medical focus, and if we were going to house male and female offenders, we're going to have a degree of separation. We're going to have the design flexibility built in so that we can keep those separate. And also, it's going to take more in staff for a focused treatment for mental health. So you don't get the bang for your buck, but it's not about the numbers versus the dollar. It's about the treatment in these facilities. So there's no way around it being more expensive for this kind of a facility. I would call it a necessary expense, and I've saw that in high custody male prisons. I've saw it in the mental health and medical facilities. It's just part of the game. I hope that answers your question, but operationally, you don't get the bang for your buck when you're specialized in treatment.
All right. Yep. Thank you.
Right. I think last on the agenda, and we can do this fairly quickly, is we wanted to get an overview on any kind of telework or remote work that may be occurring right now.
Currently, the Department of Juvenile Justice has need to get a new prescription for the glasses. We have 1,177 employees who are not eligible for telecommuting, and those include, the staff members that work at the 24/7 residential facilities. Those staff members are not eligible for telecommuting or day treatment or in transportation, in our transportation branch. They have to be on the job 5 days per week or whatever their shift assignments are. DJJ has other employees who are subject to executive branch personnel cabinet policy for telecommuting. Currently, we have 338 employees that have telework agreements. These understand that most of these employees are either central office, they're community workers that work out into the community, and most recently we've really benefited from those telework agreements because of the inclement weather. It allows those staff members the flexibility to negotiate the weather, and just most recently we had the Pikeville office that flooded, and we lost our community office. We couldn't habitate that office, so the telework agreement allowed us the flexibility to let that staff member work from home until we can sign another lease and order their equipment and get them into another office, or either to locate them in an existing office. Do you have any questions about the telework agreements?
Well, what positions are eligible? Can you give me an example?
Yeah, it would be mostly administrative assistant positions, community worker positions, those that work out with the children in the community. So it's not correctional officers. It's not the supervisors of the correctional staff or the youth workers in the facilities. It's not the mental health providers in the facilities. So if they work in a residential facility, they're required to work in that facility 5 days a week or whatever their full-time schedule is. So these are other positions, whether they would be in the community or they would be administrative type positions or clerical positions.
So if I understand the number, 338 employees do telework, or they're eligible to telework?
338 have a current telework agreement.
Okay. Any other questions? Okay. Representative Decker.
Thank you. Thank you for your presentation. I'm wondering about this administrative assistant. How many of those are administrative assistants in the 338?
I don't think that we have a breakdown of all of those positions that are teleworking by type, and I can get that information for you.
Just curious about what kind of work they do. I have an administrative assistant. It's one that I do not think should work from home. She needs to be there to do, and you said clerical. What kind of work, is that what the administrative assistant does, and where is the clerical work, and where is it stored, and what kind is it?
Yeah, I can expand on that.
Thank you.
Representative Decker. I have an administrative assistant that's assigned to me, and she works from home 2 days a week, and while she's working from home, she'll be taking care of clerical work that I need her to. We will be communicating back and forth either by cell phone or through the computer. She'll be setting up scheduled meetings for myself and taking care of other clerical duties. And she's able to perform that because we provide the equipment and the network access for those staff members from home. We could have human resources staff members, and while they're home, if they're working from home on a telecommuting agreement, they can be working on various types of task that's associated within human resources. Whether they're sitting in the office at work or they're at home, they can work on those same type of tasks and get the same productivity. Now, I will say that some of the human resources type duties, they have to be in person. They have to be on the ground so that they can be available to staff members. But we can get you a better breakdown.
Thank you.
Yes, ma'am.
Thank you.
Okay. Representative Kulkarni.
Thank you. That just prompted a quick question for me. So we're talking about administrative staff. You mentioned HR. And you mentioned that you provide them with equipment. My question has to do with the sensitive nature of any, confidential or private data or anything like that. So what kind of systems are you using to ensure the security of it?
Well, whether it be cell phones or laptop computers, those computers, have the same COT types of firewalls built into those computers. For instance, I have a laptop that I can use in a remote office or if I'm on the road. So we have all the same security features built in. COT is actually outstanding, almost to an annoying degree within Kentucky. And they provide all of the same security type features. If that laptop were to be lost or stolen, there's codes that's built into it. It's really COT is really good working with us to enable all those security features. So to date, we've had no breaches of security. We've had no issues with that equipment and the availability or the security of the equipment. Yes, ma'am.
All right, no other questions. We will be adjourned. Our next meeting is
The 25th.
March or February 25th.